a 56-year-old man who had a peculiar problem 25 years back. He had a sudden onset of severe pain in his back, somewhere in the middle of the back, following a very heavy exertion where he was trying to lift a heavy load. And following that, he has severe pain. He had to be carried to his house, and he had to be given painkillers for a few days. After that, he recovered totally. Now, since the last 5 years, he has had a gradual onset of difficulty in walking, and he is walking as if he is not able to. He is dragging his right feet and perhaps his left feet also. So that is his main complaint. Now we'll show you as to why this is happening. So we look at his biceps. So when we hit the biceps, there is no contraction in the biceps per se, but there is a contraction in the supinator. It's called the inversion of the supinator reflex. And when we hit the brachioradialis, there is again a contraction of the supinator, which is again an exaggerated C8 reflex. Now the C7 triceps is also very much exaggerated. Same thing is happening here, except the biceps here is exaggerated. It is not inverted supinator, but the bicep itself is exaggerated, which means there is a above C5 lesion here. That's in the C4 of the spinal cord, whereas here the lesion is in C5. So right side he has a C5 lesion, left side he has a C4 lesion, and the other things are similar. Triceps is exaggerated. We can quickly take a look at this abdominal reflex, whether there is exaggeration here or not, or whether it is reduced. Now what you can see is there is some mild perhaps contraction in the left side of the abdominal quadrant, but no, generally it is kind of, it is absent, you can say. The abdominal reflex is absent, the superficial abdominal reflex is absent, which is again a highlight of the effect of the spinal cord getting affected. And this is very much exaggerated, and you can see that there is a clonus. When we are doing this, there is a clonus. So you can see, I don't know whether the mobile phone is able to take the clonus, but just by lifting the knee, I am having a clonus. And it's kind of a patellar clonus here if you focus here, and of course there will be a ankle clonus here if we focus here. Like we have to put it up, and we have to hit it. We have to push the thing properly, but flexing this knee itself is becoming a problem because of the spasticity. And of course the ankle is also quite exaggerated here and here. So there's a clasp knife spasticity here, which is again the UMN thing. Now there's a very interesting new feature we noted, actually seen by the patient's son, who we should like to say that he is the discoverer of this new clinical sign to us. I don't know whether it's really new. So when you press on one of these fingers, there is a flexor spasm on the thigh, which it is getting demonstrated here. So I pressed on the middle toe, and automatically the patient's knee joint got flexed. So I'm sure it may have been described earlier because we had so many Babinski, this and that, Shaddocks, Gordons and all those things. So perhaps one of those. But yeah, this is what the son pointed out to us. Shall we?